and I was gonna go from there.
Some of the hair loss is if you wear your hair up a lot.
Hiya.
It's
Yeah.
gonna be
Hiya.
because of just the tension from a
Yes.
hairstyle.
Yeah, I think like during the pandemic too, I was wearing my hair up a lot, like before I started working here.
I need you to take your hair down first.
Okay, sure.
And Dr. Lehmer was saying that you have a lot of plasma, so good on you. Nice.
Yeah.
You're a plasma machine.
You make sure she drank lots of water before.
Yes.
And it's a nice clear color, meaning that you have a nice healthy diet. It's not too high
Oh,
in
good.
cholesterol or saturated fat. So.
Oh, somebody else wants to join us. Oh,
Hey.
Hey.
wow.
Liver.
We're going to town.
I have to split your hair.
Oh, okay,
So
you'll
one
do it.
second.
Go here. Alright.
PRP 1. So Mackenzie, you have to take photos of our patients when they do the PRP so that if we have good results or so that the provider can monitor the progression of the
Hair growth.
hair growth and, you know, if we wanted to use the photos too.
I'm sorry, what was that? Why are you taking pictures?
Oh, so that our providers can monitor the progression of the treatment as, you know, since it does require 4 treatments. And then that way if they're, you know, the patient can also see the difference because sometimes people won't really notice a difference since it's like one of those things where you can't really tell. So pictures always really help.
Yes. I find that to be true too. For every cosmetic treatment that I've seen patients get, not everyone, but oftentimes they're like, wait, I don't see a difference. And then you put the side by side there and all of a sudden there's a big improvement. So fingers crossed we see a big improvement for you, Izzy.
Yay. Fingers
How much
crossed.
improvement could she expect, Dr. Lehmer, after 4 treatments?
After 4 treatments, 3 months out from that, she can expect to see a 50% improvement. This would be
50?
yes.
Dang.
Yeah. It depends on the type of hair loss being treated, but for the type of hair loss, if it's a type of hair loss that's due to stress, then that is what we would expect, because again, we're just giving her back a little bit of like some nutrients and helping her body recover. Other types of like scarring hair loss may not respond quite as robustly, but for her, I would expect a 50%.
So when you see a patient that's this age, you know, obviously she's a little bit on the younger side, is that usually who responds
Yes.
better?
Yes, she is the type of patient who has usually the best response.
Right. So if somebody is like Izzy's age, and we don't have to say how old she is, but you know, in their 20s, and they're troubled by this hair loss, they should seek treatment.
Yeah, exactly. I mean, they have to have a diagnosis like, first, like, you know, make sure that there's no underlying other things that we need to get out of the way, like, you know, an iron deficiency or something like of that nature. But once that's been ruled out, then this is a beautiful treatment.
All right, let's go. Let's do
Woohoo,
this
let's
thing.
do it.
And this thing over here is going to be loud, but it says a Zimmer. It's going to keep the area cool while Dr. Lehmer does the injection. Okay?
It's still pretty cool right now.
Pre-cooling. Would this improve on its own, like if she didn't get treatment?
Yeah, it some of this would, especially if say if she were in a position to always wear her hair down. You can see that she's getting a little bit of these baby hairs back already.
Uh-huh.
So, but sometimes these baby hairs need a little bit more help to just like keep going when they have a little extra stress, like from our hairstyle, or even just, you know, the ongoing stresses of there being a pandemic around and needing to be a little bit more vigilant to maintain a longer growth phase. Because sometimes it's just that we're losing our hair before it's grown out to like be able to be put in that ponytail and really feel the weight of it.
I also have to mention that I got blood work done here and I was vitamin D deficient. So I started taking Nutrafol, which has vitamin D in it, as recommended by our office.
And you're saying vitamin D is in dog.
Yeah, D as in dog,
Okay.
like lack of sun.
Yes, lack of sun. Okay. So, Dr. Lehmer, would you say people shouldn't wear their hair in ponytails? Is that...
You can, but it's just good to vary the style. So like obviously we have to wear it back a lot here because clean and professional is really important. But like I'll switch from doing something that's like a braided style and wrapped into a bun maybe, or like a bun up like this, or a ponytail and like different positions on the head. So ponytails are known to be really rough or tight braids, so it's better to do a loose style if possible.
Interesting. Mackenzie's got her up too. And so does Camille.
It's
loose.
She's in a nice loose bun, as does Camille.
And does this hurt, Dr. Lehmer? What we're doing here?
It does, but it's not like the injections last forever. So once the injection's done, it doesn't usually keep hurting.
So while you're doing the actual injection portion, that part hurts, but then after it's done, no more pain.
Yeah.
Beauty is pain.
Beauty is pain.
Beauty is pain.
I'm just cleaning our scalpel. Really, it's not necessary.
Yeah.
I don't think that many people really do this, but I have the alcohol pads.
Yeah.
I think with the Zimmer on, we won't be able to hear anything anymore.
Okay.
You want to stop really quick?
No.
So I'm gonna do this side next to
Do you
me,
want this on?
and then over here. No, that's not necessary.
Okay.
So let's see. You were even pointing all the way out to this side, right? In terms of being
Yeah.
in a problem area.
Yeah, television.
All right. So go ahead and as close as here. There you go. Closer. Okay, poke. 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 Now we're gonna
My ear.
How you doing?
That was not that bad.
here. Poke.
Not that bad, okay.
Poke. 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 Poke.
Doing great.
So now we're gonna do another one there. Poke. 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 Sorry.
That's okay.
Oh yeah.
Thank you.
In the editing, I can just make this all fast forwarded, right?
Yeah.
Really coolness.
Ooh, it's a little sore.
It hurt?
A little. It's not too bad.
Yeah, sometimes there's a little pressure.
Yeah, I feel the pressure.
Oh, you have a mole on top of your head.
Oh,
Oh.
skin check. No, I'm kidding.
All right, I'm gonna switch around
Whoa,
the other
it's
side.
like aching.
Oh, it's aching.
Yeah, it's
Okay.
aching. But the pokes weren't that bad.
But that'll go down after the volume.
Uh-huh.
Kind of gets absorbed.
Okay.
Are you able to? You want me
Yeah,
to hold it?
I can go to that side. Of you. Not get too cold. Getting like a calf workout.
We need a little stepping stool, huh?
can see that mole that we found before. A marker.
Just like planting seeds in a garden.
Yep.
Leia said that too when she had her the achy feeling.
Yeah.
Nice muscles, Dr. Lehmer.
Oh, thank God. Oh, that's even like my non-baby arm.
Huh?
You're good.
Yeah, I'm okay.
Oh, I didn't.
Oh, I didn't know you were on your tippy toes too. I thought it was just me. I'm like, maybe Dr. Lehmer's a lot taller than me.
I think I didn't realize that the chair was up, actually. I was like, oh, Izzy's...
My
Izzy's
platform
taller.
shoes aren't enough platform.
Alright, poke. 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 Poke.
Oh my god, I heard that one.
Oh, really?
Yeah.
Close to your ear.
Like the squishy noise.
Alright, that's it.
Oh yay! It feels super weird. Yeah, there's a lot of pressure on my head.
Okay. And that'll sink out. I guess I should say you don't usually go home and have hours of discomfort, but yeah, a little tension
Yeah.
right afterwards isn't unusual.
Let's get it, yay! Are you happy it's over?
Woo,